In today's society, we really have a problem with children not being able to make eye contact because they spend a lot of time looking at their little screens. So at the International Association of Infant Massage, we encourage parents to make eye contact with their babies during massage. We use eye contact during when we're asking for permission. We look at the baby and we see if the baby is happy to receive massage, because they do show a lot of cues in the eyes through the eye contact. The eyes truly are the windows of the soul. Eye contact also creates a powerful feeling of love and belonging. And this is where communication starts, because eye contact really is the foundation of effective communication. Julia?
You stole some of my points there. Absolutely, it's about establishing communication for me as a therapist with a parent and child as fast and as comfortably as possible. And one of the things I will be observing during the treatment is the level of eye contact between the parent and the child. It makes me feel happy and relieved and positive when I see the baby looking up at the parent and knowing that the parent is there and everything is okay. The child gets a lot of cues and comfort and trust from the parent. It's also interesting for me to observe the level of eye contact between the baby and me. A teeny baby, a baby of days old, at a point in the treatment will turn and look me directly in the eye. And you get the sense that they're saying, thank you, and I appreciate that, and I needed that, and their bodies relax. That's a very important therapeutic moment. If I see that the baby, from the moment I meet them at the car to the treatment, during the treatment and the end, is simply unable to glance over at me, that as a therapist is a flag to me. There is something we need to work on. Perhaps baby massage would be an incredible way to teach the parent and the child eye contact, but it is also a question mark and a flag to me of what is going on in the brain of this child, that this very basic reflex, this primitive thing all humans can do, which is to look in the eyes, is not present. And how can we help the brain to develop that? And I wanted to add precisely the thing. I do not allow tablets or screens in my treatment at all. I find it quite alarming that even babies as young as 4 months will be offered a screen as soon as they start giving information to us. I want to understand the information, I want to communicate, and more importantly, I do not want to teach children that communication is through their eyes and a screen. It needs to be between the humans, and ditto, parents sitting on a phone disconnected from their child during the treatment is completely inappropriate. It speaks to a problem in communication in our world, and it's something we really need to address. Eye contact is essential. If it's not there, we need to get to work on it, and through one of our techniques or another, it must happen.
Yes, and absolutely. You spoke about the very small babies, and of course we cannot expect a 1-week-old baby to be able to make eye contact with the parent all the time. Usually they start making eye contact around the age of 6 weeks. And before that, to have good eye contact with the parent, we also will encourage the parent to position the baby so that the baby is closer to the parent's face. And this is also, of course, nice because then they can smell each other better as well.
It's a whole sensory wonderland, just the parents and the baby growing with each other together.